how does a file get handled? What's the sort of touch points between industry and this decision-making process? And how do we sort of keep this, very, I think we talked already about how HTA is a structured sort of objective process, but we make sure that this is a process sort of free of undue influence, but coming to a beneficial outcome for our patient populations?
Yeah, so great question. I'm really happy to walk through this. I think there's a few things to understand. And you talked a little bit about, you hear about a trial at a conference and then you sit and wait and wonder what's happening. I heard about this a year ago. The first thing to understand is we cannot review a file until it is approved by Health Canada. Health Canada cannot review a file until they receive the file. And this happens, right? So a sponsor may decide to submit in another country and they may delay filing, for another year into Canada. So Health Canada can't do anything until that actual file is submitted to them. So now Health Canada has a file. I've already mentioned that we can review in parallel, and we encourage that. But we can't review the file until the sponsor files with us. And it's up to them as to when to do that. Sometimes there's a filing gap. Sometimes they file with Health Canada, they receive approval, and they wait a little while before filing with us. So it's important to know that our trigger for a review is an actual application or submission by the sponsor. We receive the file. There's a little bit of back and forth as we're doing a bit of screening. Then we accept the file, and then we begin our review. And so quite a lot goes into the review. There's sort of the review of the clinical evidence that is submitted by the sponsor. There is input from patient groups, input from clinician groups, which your audience will know very well. We get input from the public drug plans. And more recently, we started to get input from a person with lived experience presenting to the committee. We started that at FMEC, and we'll be starting that at CDEC and PERC in October of this year.